Ever wondered what rheumatoid arthritis is and how it's diagnosed? If so, you're in the right place. Rheumatoid arthritis, often shortened to RA, is a long-term autoimmune disorder that primarily affects the joints. It's a condition where your immune system, the body's defense mechanism against diseases, mistakenly attacks your own body's tissues. RA mainly targets the lining of your joints, causing a painful swelling that can eventually lead to joint deformity and bone erosion. It's not limited to the joints though, it can also affect other parts of the body, including the skin, eyes, lungs, heart, and blood vessels. An RA flare, as it's often called, can cause joints to become warm, swollen, and painful, making daily activities challenging. But don't worry. Despite its chronic nature, there's a lot that can be done to manage the symptoms and improve quality of life. Now that you have a general idea about rheumatoid arthritis, let's delve deeper into the details. You might ask, how can someone identify if they have rheumatoid arthritis? Well, it starts with understanding the symptoms. Rheumatoid arthritis often presents itself with joint pain, a sensation that may feel like a persistent and uncomfortable ache within your joints. This pain can be accompanied by stiffness, particularly after periods of inactivity or first thing in the morning. Swelling is another common symptom. You might notice that your joints appear larger or puffier than usual. This swelling can sometimes lead to a loss of joint function, making it difficult to perform regular tasks like opening a jar or tying your shoes. Keep in mind, these symptoms aren't always constant. They can range from mild to severe and may even come and go. Some days may feel like a breeze, while others can be particularly challenging. Understanding these symptoms is key in identifying rheumatoid arthritis. Identifying these symptoms is the first step towards diagnosis. So, how do doctors diagnose rheumatoid arthritis? Well, it starts with a physical examination. Your doctor will check your joints for swelling, redness, and warmth. They'll also want to see how well you can move your joints. Depending on the severity and length of your symptoms, your doctor might suspect rheumatoid arthritis at this point. But to confirm, they'll need to conduct more tests. Next up, blood tests. These are done to look for antibodies like the rheumatoid factor and anticyclic citrullonated peptide. These are commonly found in people with rheumatoid arthritis, but not everyone has them. Doctors also check for C-reactive protein and erythrocyte sedimentation rate. These are markers of inflammation that can indicate disease activity. But remember, these are not definitive tests. They simply provide clues for the doctor. Then we come to imaging tests. X-rays can help track the progression of rheumatoid arthritis over time. MRI and ultrasound tests can create more detailed images of your joints, potentially helping to reveal early rheumatoid arthritis signs. Now, it's important to note that there is no single definitive test for rheumatoid arthritis. It's like a puzzle, where the pieces come together to form a picture. Each test provides a piece of that puzzle. The diagnosis is based on the combined symptoms and results from these tests. Also, rheumatoid arthritis can mimic other diseases, making the diagnosis a bit challenging. This is why doctors may need to monitor your symptoms and results over time to ensure an accurate diagnosis. In some cases, doctors might refer you to a rheumatologist, a specialist in arthritis and other related conditions. They have the expertise to deal with more complex cases and can provide a more definitive diagnosis. Diagnosis might seem complex, but it is a thorough process to ensure accurate results. After all, the goal is to get you the most effective treatment for your condition, and that begins with a precise diagnosis. After diagnosis, what next? That's the question that comes up in our minds. Let's delve right into the treatment options for rheumatoid arthritis. The key aim of treatment is to alleviate symptoms, prevent joint damage, and enhance quality of life. It's a multifaceted approach that involves medications, physical therapy, and in some cases, surgery. Let's start with medications. There's a vast array of drugs available. It may seem overwhelming, but don't worry. Your healthcare provider will guide you to the best choice for your situation. The most commonly used drugs are known as DMARDs, disease-modifying anti-rheumatic drugs. These are designed to slow down the progression of the disease and save the joints and other tissues from permanent damage. Other classes of drugs include biologics and JAK inhibitors, which target various processes of the immune system. Next, we have physical therapy. A physical therapist can provide exercises to keep joints flexible and improve your muscle strength. They can also suggest new ways to carry out daily tasks, which could be easier on your joints. For some, physical therapy can be a game changer, helping to maintain mobility and independence. In severe cases, when the joint damage is extensive or when other treatments fail to control the symptoms, surgery might be an option. Surgeries can correct deformities, reduce pain, and improve joint function. Types of surgeries range from synovectomy, which is the removal of the inflamed lining of the joint, to total joint replacement. It's important to understand that the treatment for rheumatoid arthritis is highly individualized. What works for one person may not work for another. This is due to the fact that the disease severity, symptoms, and progression can greatly differ from person to person. It's a journey of trial and error to find the most effective treatment plan. In essence, the treatment journey is not a one-size-fits-all. It's a tailored suit made to fit each patient's unique needs and condition severity. It involves a close partnership between the patient and the healthcare provider, aiming for the best possible outcome. Treatment is tailored according to the patient's needs and severity of the condition. So remember to keep an open line of communication with your healthcare provider, and together you can manage rheumatoid arthritis effectively. So, what have we learned about rheumatoid arthritis and its diagnosis? It's clear that rheumatoid arthritis, or RA, is an autoimmune disorder that primarily affects the joints, causing inflammation, pain, and stiffness. Remember, the symptoms can vary from person to person and can often mimic other illnesses, making it a bit tricky to diagnose. We've also discovered that the diagnosis process often involves a combination of physical exams, blood tests, and imaging studies. It's not a one-shot deal and may need multiple consultations. When it comes to treatment, there is no one-size-fits-all approach. It can range from medication, physical therapy, to even surgery in severe cases. The goal is to control symptoms, prevent joint damage, and maintain a good quality of life. Understanding rheumatoid arthritis and its diagnosis process can help in early detection and treatment. Stay informed and take care of your health.